is an ABC News special, COVID-19, What You Need to Know. Here is ABC News correspondent Aaron Katursky.
A number of countries and some states are now beginning to tiptoe away from coronavirus so we can all take our first tentative steps toward the door. Governors on both coasts have formed alliances to jointly tackle the job. 7 Northeast states have agreed to...
has to be in place first.
ABC's Alex Stone in Los Angeles, and as if to reinforce this take-it-slow approach, California reported its highest single-day death toll from coronavirus. On the opposite side of the country, New York may have reached a coronavirus plateau, but one at what Governor Andrew Cuomo called a devastating level of pain and grief. The death toll in this state nears 11,000, and in particular, deaths in nursing homes, the governor called troublingly high.
The percentage of loss of life is getting higher in the nursing homes compared to the hospitals.
In Massachusetts, Governor Charlie Baker said nearly half of the coronavirus deaths in his state occurred among nursing home residents.
My dad's in one of those facilities, so I take this stuff pretty seriously.
Dr. Imran Ali joins us now from the University of Connecticut Center on Aging. Why are so many dying in nursing homes in this pandemic?
Well, we know that we're dealing with a population which is significantly older. And although we see coronavirus infections in anybody as young as, 5 years old, even younger, to age 99, the majority of people who die from this disease is still those people who are above 65, and those who have multiple comorbidities. And if you look at the average adult, older adult over age 65, they have diabetes, hypertension, COPD, lung disease, heart disease, and they're on so many different medications to manage all these things. And we are now learning a little bit more about this virus, that it not only causes lung problems, it causes significant heart problems, almost a viral myocarditis, where the virus itself affects the tissue of the heart, making the heart less efficient in pumping. And that is also another contributing factor of why we see so many people do so poorly in advanced age, because they already have so many issues with their heart and their lungs to begin with.
Is there something about the nursing home itself that's an incubator for this virus?
Well, we do know that certified nurses' aides, and I know personally that a lot of them are turning up positive, and hence that's why they're so afraid of losing their jobs, and some of them don't want to be tested, period. Because they are in very close contact with these patients. And so if there is a spread, it's going to happen, very quickly, because there's a lot of close contact with one certified nurse's aide among many residents, because there's a staffing issue. So there's one nurse's aide for maybe 10 patients. So if that nurse's aide is positive, they're in very close contact with potentially 10 patients. And these nurses' aides are feeding patients, providing breathing treatments, changing them. They're spending prolonged periods of time with these patients. So the possibility of not only catching a virus, but spreading it is really high.
Are nursing homes safe for the residents at this point?
So, Aaron, I get this question asked a lot of times, and, I'm going to have to agree with the Los Angeles County Health Director. If your relative or loved one is relatively independent, at this point in time, if you can take them out of the nursing home for the time being, I would suggest that would be a wise thing to do if you're able to care for them at home. And I say that because it's just a fact of the matter that we really don't know the scope of the problem right now until we get more testing done, and until we have more staffing that we can have, a reduced risk of transmitting this infection. I think right now nursing homes are a place where it's really unclear how bad the infection rates are. But from the statistics that we're getting out of New York and from Los Angeles, I think it shows that we're really seeing a high rate of infections in nursing homes, particularly.
Dr. Imran Ali at the Yukon Center on Aging. A FEMA official told ABC News the Centers for Disease Control and federal regulators have now finalized a plan for nursing homes to report COVID-19 data to the National Healthcare Safety Network. The hope now is to find a solution to this incredibly high death rate in the nation's long-term care facilities. With tens of millions of Americans set to receive stimulus payments this week from the federal government, scam artists see an opportunity. Donna Harris of the U.S. Postal Inspection Service is with us now. The checks are in the mail this week. Donna, what could possibly go wrong?
You know, scammers, anytime there's a opportunity, scammers look at a crisis as an opportunity, and anytime